Hi, and welcome to Teresa's Tales and Teachings. And I'm starting this series because I think it's important to share with others what's going on and what I'm really passionate about as a lifeologist, an intuitive life coach, and also an award-winning author. But my main passion is helping people who experience brain trauma and chronic pain in their everyday lives. And that's what this little teaching is about this morning. I was writing an article this morning for an upcoming media shoot, and it's revolving around people that experience and have experienced brain trauma in their lives, which could be from many different sources: concussion syndrome, shaken baby syndrome, whiplash from major vehicle car accidents, or just falling down the stairs and hitting your head. I mean, there's so many different ways that brain trauma can be caused, and there are so many different titles for it nowadays. And it's thankfully to the sports industry that's actually created a lot of awareness around concussion syndrome, with major hockey players and football players, all sorts of athletes that are coming out and experiencing and talking about their experiences and lives with concussion syndrome, which is brain trauma. My other topic that I'd like to touch on today is people who live with chronic pain. And chronic pain is not something that's in your head. It's not caused by depression. It's not something that's made up by people. In some cases, it seems like people are talking about chronic pain because people think they need attention. Not always true. People do not really want to live in chronic pain. That's not something that I find very enjoyable. And I experience that on every day of my life to varying degrees. Some days, the pain I have in my neck and my spine is so severe that I just absolutely want to crawl into my bed crying and screaming. That's how bad the pain is. However, it doesn't serve a purpose to just give in to it. What I'm here to explain is, and this is what my media shoot will be all about, is living with brain injury and concussion syndrome and also chronic pain. I'm here to tell you it does not have to control your life. It does not have to be the number one main focus and driving force in your life. It is manageable. It's all in how we change our mindset, how we educate ourselves, and what we do with that. And also, it's very important to have a great support system in place. Sometimes family and friends don't understand because they don't have the knowledge, they don't have the experience. And sometimes it's also because they can't face what's going on with you. They can't understand, and they don't always know how to support you when you're experiencing those situations. But through education and experience and talking, open conversation about what's going on, we can educate others. We can share our stories. We can share what's going on. Find a good support system for yourself. Find people that you can surround yourself with that will help you, that will guide you. But it's very important that you also find someone or a group that will not leave you stuck in what's going on in your life. If you remain stuck in the fact that, yes, I live with chronic pain, yes, I have a brain injury, oh my goodness, I'm falling apart because I have these things. If that's what kind of support you're getting, I'm here to tell you personally, it's not very good. It shouldn't, that's not how it should be. When you look for someone to support you, those people should educate you, inspire you, help you, guide you, inform you. That's very important. It's key to changing your own lifestyle. You need to reevaluate what's going on in your life. Those things are very important. You need to maybe not go out shopping as many times as you do, or I'm at home, I can't clean today because I'm in pain. Well, okay, that's fine. Okay, you can't clean today. No problem. Tomorrow might be better. Maybe you need to change how you, no, how do I put it? You need to change, sorry about this, you need to change your way of cleaning. You need to change the importance factor behind that. Okay, you have chronic pain. You can't clean your house maybe as well as you used to. You have injuries. Cleaning shouldn't be the number one priority in your life. That's what I'm trying to say in a long round way. But what we need to do is reevaluate what's important in our lives, what we need to change in our lives, what we need to increase in our lives, and what we need to decrease in our lives. That's how we'll find fulfillment. That's how we will learn how we need to be, what we need to do, and how we can share that with others. So, rambling on, sorry about that. It's important that we share our stories about living with brain trauma, brain injury, and chronic pain. We need to talk to other people about it and find a great support system. That's what I am all about. That's what my main passion is, because I do live with that every day of my life. I have had at least 3 severe concussions in my life and experienced short-term memory loss. I live with chronic pain every day from severe spinal injuries and neck damage. And there's many ways of looking at it. You can either let it control you, or you can take control over that. That's what's important. And I'd love to share those tips with you. And I will be talking more about this and sharing more insights. Thank you for listening. And I look forward to seeing you again soon.